Basics of In-Office Infection Control is presented by Linda McClarty, BA.
Hi, my name is Linda McClarty, and I am Educational Support Manager for Germaphene Corporation. Correctly performed infection control and infection prevention is the most cost-effective way to ensure safe dentistry for your patients, your co-workers, yourself, and ultimately your family. Not a day goes by that we don't hear of the emergence of a new disease or re-emergence of an existing disease that we really thought had been eradicated. Combine this with improper infection control procedures and potentially life-threatening situations can occur. In Alberta last year, it made the news that syringes were being reused in IV lines. 1,400 dental surgery patients, mostly children, since 1990 may have been placed at risk. Needless to say, there was substantial finger pointing, and two main issues have been raised. First of all, the nurses should have been trained correctly, but more importantly, as nurses, they should have known better. A nursing professor and researcher at the University of Alberta has said, every nurse, every doctor, every dentist is responsible to provide safe and effective health care, and that means they have to keep up. They have to inspect their practice, they have to keep their knowledge up, they have to keep their skills up, they have to practice safely. Consciously or unconsciously, you spend all day breaking the chain of infection. There's been a fair amount of publication with regards to MRSA outbreaks. And I had a call from an office wanting to know what should be done in the dental setting with regards to MRSA. The main mode of transmission for MRSA is via hands, either directly from an infected person or directly from items or surfaces containing MRSA. Standard precautions that you practice day in and day out, like hand washing, the use of gloves, the correct use of personal protective equipment, masks, protective clothing, careful handling of sharps, the appropriate care, handling, disinfection of equipment, and sterilization of instruments, all combine to ensure that any potential infectious disease is stopped when you're performing care on your patients. I spend far more time reading labels in grocery stores than I ever used to. I check for calories, fat content, salt content, then I compare different brands. Don't think I'm particularly unusual because I see more and more people taking extra time at the grocery store reading the labels. Health Canada's guidelines for disinfectant labels is more than 50 pages long and includes their mission statement. Summarized, it is to minimize health risk factors while maximizing safety for Canadians. They promote conditions that enable you to make healthy choices and provide information so you can make informed decisions. A product label of a disinfectant is the best place for information. Health Canada approves product labels. They do not approve advertising material that is dropped off at your dental office. If you want to make a comparison with regards to a product that you are using in your dental practice, then the wisest place to make the comparison is comparing label to label. When it comes to choosing a disinfectant for your office, you want a product that will provide the best protection for you, your patients, your co-workers, and once again, ultimately your family. If you are as old as I am, you'll remember when cars didn't have seat belts. Kids would hang their heads out the windows just like dogs. Now we have seat belts, infant and children car seats, and airbags, all with the intent of making us safer. 140 years ago, a common saying was that the operation was a success, but the patient died. Dr. Joseph Lister started to use an antiseptic in surgery, dramatically reducing the mortality rate. Listerine mouthwash was named after Lister, and the common Band-Aid can directly be traced to Lister's influence. Antiseptics and disinfectants have dramatically changed over the past few years. Where do you begin to make an informed decision for your office? Again, the product label gives you all of the necessary information. All you really need is the time to read it. This chart from Health Canada's infection control guidelines shows the most difficult organism to kill to the easiest to kill using chemical germicides. Bacteria with spores, like C. difficile, are the most difficult to kill, whereas HIV, Hep, or herpes is relatively easy to kill and is at the bottom of the chart. Claims appear on the front of the label. Sterilants and high-level disinfectants will be labeled sporicidal. As you can see on this label, the product is labeled tuberculocidal, fungicidal, sporicidal, and bactericidal. Sterilants and high-level disinfectants are used in dental offices for instruments that cannot be processed through an autoclave. A virucidal claim without an asterisk means the product is effective against non-envelope viruses. Polio is the test organism used by Health Canada for this claim. If there is an asterisk after the virucidal claim on the label, you have to read the small print to find out what virus the product is effective against. Quite often, it is easier to kill viruses like herpes, HIV, or hepatitis. Infection control guidelines for dentistry recommend a disinfectant that is tuberculocidal. The test organism for this claim is the most difficult to kill bacteria. TB has not been chosen because there's a greater incidence of TB in your dental practice. It's just the most difficult to kill bacteria, and if the product is labeled tuberculocidal, it will be able to kill the less susceptible bacteria like HIV and hepatitis. Fungi are everywhere, and orally, Candida is a growing problem. Aerosols you generate during your workday contain fungi that can land on surfaces, clothing, and masks. You want to use a product that is labeled fungicidal to deal with this type of contamination. A product that is labeled bactericidal designates killing power against vegetative bacteria, Staph, Pseudomonas, Salmonella, and E. coli. A product that offers broad-spectrum disinfection is the best choice for your dental practice. Virucidal with no asterisks, tuberculocidal, fungicidal, and tuberculocidal. There are lots of choices available. Just remember that when you're looking and making a decision with regards to the product you want to use in your practice, that you compare label to label. This is the information that is reviewed by Health Canada and provides the best assurance for you. What else should be on the label? As you can see, on the top of the label is a DIN number. This is assigned by Health Canada with regards to registration of disinfectants and sterilants in Canada. The DIN assures you that the product will be effective against the organisms listed as long as you follow the label directions. Testing requirements do vary from country to country, and label claims also vary. In Canada, a disinfectant must have a drug identification number before the product can be sold in Canada. The product must also be identified by the manufacturer with a lot number. This tracks the product in the event of a recall. Did anyone purchase any of the recalled meats as a result of the Listeria outbreak in the summer of 2008? Packaged meats were recalled on the basis of the lot number, and this helped you in the event that you were concerned with regards to any of the packaged meats that you did have in your house. The expiry date will also appear on the product that you are using in your office. This is not a best before date. I finally cleaned out my fridge a week ago and got rid of salad dressings that unfortunately should have been disposed of a year ago. Manufacturers must be able to substantiate the shelf life of a product. The expiry date acknowledges the product will perform as labeled up until that date. At least twice a month, I receive calls from dental offices wanting to know if the product is effective past the expiry date. The expiry date is there for both your protection and for the manufacturer's protection. Please dispose of and do not use products that are past their expiry date. The name of the product as well as intended use of the product is very prominent on the label. Please ensure that the product that you're using is applicable for its use. If the product is labeled as a hard surface disinfectant cleaner, then that is the type of product you should be using to deal with environmental contact surfaces in your practice. I had a call from an office once that was using an evacuation system cleaner in their dental unit water lines. Needless to say, someone had not taken the time to read the label. The active ingredients of a product are a mandatory part of the label. Knowing what the active ingredient is in the product that you're using can help you make decisions about the product. As stated, Health Canada's mandate is to protect your health. Products are not registered without a thorough review of the ingredients and their suitability and safety in the dental office. Some active ingredients, high ethanol type products as an example, are not particularly friendly to plastics or upholstery. There are products that are available that are more compatible with both hard and soft surfaces in your dental practice. Some chemicals don't mix. I stupidly was using ammonia and bleach one day when I got particularly aggressive about cleaning my bathroom. The same thing applies in your office. There may be a reaction between the products you use to clean and disinfect. Maybe not as drastic as mixing ammonia and bleach, but chairs or surfaces may discolor because of the disinfectant or combination of disinfectant cleaners you are using. If you are changing products in your dental office, it is always a good idea to clean all surfaces with soap and water. And if you have time, this is a very good practice to follow once a week. Once you've read the front label of the product, then you get into the fine print. Who has the time to do this when you're running 30 minutes behind? If you're starting in a new office, do you just count on training or experience to use the product? Think about those nurses in Alberta who were trained to reuse IV needles. Did they forget all that they'd been taught in school? Remember, if you aren't following the directions that are on the label, then the product may not be doing what you expect it to do. Follow the directions. Ask questions if you don't know. Most dental offices have ready-to-use products for disinfecting surfaces. They save time by not having to measure and mix. If a product does have to be measured and mixed, how long is the mixed solution good for? Are you sure it was made in the right proportions? If you run out, who has the time to make up new solution? You know, time is money. Quick patient turnaround time is important, and ready-to-use product is just quicker to use, ready to go, no mixing. All disinfectants must be used on clean surfaces. Just because the countertop looks clean doesn't mean it is clean. Cleaning is the essential first step. If you don't remove contaminants, seen or unseen, the disinfectant might not work. If it isn't going to work, then why do it? Cleaning reduces the microbial population and may even kill some of the bugs. It readies the surface so the disinfectant can do what it is labeled to do: kill TB, bacteria, fungi, and viruses. Correct personal protective equipment should be worn when readying the operatory for the next patient. Ideally, general purpose utility gloves that are puncture and chemical resistant should be used. Examination gloves may be weakened with exposure to disinfectants and don't afford the protection that you require. Gloves, gowns, face mask or eye coverings, as appropriate, must be worn during all cleaning of body fluids, blood, and decontamination procedures. Feedback I've received is that general purpose utility gloves tend not to be used. Again, the recommendation on the label is made there to ensure your health and safety. All disinfectants have to be strong enough to kill the organisms that are listed on the label. Wearing personal protective equipment is on the label of all disinfectants to protect you as you ready the room for your next patient. The standard procedure for disinfecting surfaces is spray, wipe, spray. Concerns about aerosols in dentistry, however, have modified this practice to spraying directly into an applicator, wiping, disposing of that applicator, and then spraying the disinfectant into a clean applicator and wiping the surface once again. The surface must remain wet for the amount of time that it is listed on the label. If you use pre-moistened disinfectant wipes, then the first wipe is the cleaning wipe. It's to be disposed of. The second wipe applies the disinfectant, and the surface must remain wet for the amount of time that is listed on the label. Times vary for disinfectants across Canada. 1 to 3 to 5 to 10 minutes. Contact time is required. Please ensure you know the amount of time that's required for the product that you are using to once again ensure the safety of you, your patients, your co-workers, and ultimately your family. Time is money, so most of you are looking for a product with relatively quick kill time. If the product you are using is labeled with a 1 or a 3 or a 5-minute contact time, this time does not include the important first step of cleaning. Health Canada no longer allows different times for different bugs. The contact time listed on the label reflects the claims on the front panel, since you really don't know what type of contamination you are dealing with. Some manufacturers have removed claims that take longer. The disinfectant may be labeled tuberculocidal, virucidal, and bactericidal, but not fungicidal. This product takes longer to kill fungus, so it is not shown on the label. There might not be a virucidal claim. Once again, Health Canada regulates the claims that can be placed on the disinfectant that is being used in your office. Are you using a product that offers the most protection for you and your patients? Precautions such as keep out of reach of children are standard on a disinfectant label in Canada. If the product is flammable or corrosive, a warning symbol will appear on the label. Additional information is given with regards to first aid, disposal, and storage of the product. The goal of proper infection control is to ensure safety for you, your family, your co-workers, and your patients. To be able to do this, you have to read the label, fine print included. When your doctor prescribes medication for your child, you read and follow all of the directions. If you don't follow the directions, there's a possibility the medication will not work. The same premise applies for using disinfectants. Have you read the label of the disinfectant you are currently using? Or did someone just tell you how to use it? Professionally, you have an obligation to do all within your power to ensure the well-being of your patients, co-workers, you and your family. I know you are rushed throughout the day, but can you afford not to read the label? Follow the label directions and know the disinfectant you are using is doing the job for you and your patients. Ask yourself, would I let my child be the next patient in this dental chair? Clinical contact surfaces can be managed in 2 ways: surface barriers or cleaning and disinfecting between patients. Barriers protect surfaces from becoming contaminated. Between patient cleaning and disinfecting manages surfaces after they have become contaminated. Clinical contact surfaces include light handles, switches, dental x-ray equipment, reusable containers of dental materials, drawer handles, countertops, pencils, telephones, handles, and doorknobs. Surface barriers are a safe and efficient way to protect operatory surfaces against contamination. Removing and replacing barriers tend to require less work and less time than spray, wipe, spray, and waiting for disinfectant contact times. Time is money. Is it more cost-effective to use barriers that are more expensive but take less time, or to disinfect? Disinfectants tend to be an integral part of infection control in dental offices. Remember, they are only effective as labeled and when label directions are followed. Cleaning and disinfecting should begin in the waiting room for your patients. We all know that first impressions are important. Plus, your patients hear more and more about hospital-acquired infections and look more closely at all facilities where healthcare services are provided. Visit a hospital in Ontario and you're expected to use an alcohol hand gel when you first enter, then again before seeing the patient, and then when you leave the hospital. Patients keep appointments even if they have a cold. Do you have tissues available? Do you have alcohol gels available for your patients? Are countertops and doorknobs cleaned and disinfected on a regular basis? If you have artificial plants, are the leaves dusty? And remember, computer keyboards should be disinfected regularly. It is a known fact that if we all washed our hands correctly, there would be much less sickness. Unfortunately, it is often the weak link in effective infection prevention and control. An estimated 1 out of 5 people do not wash their hands after using the toilet. A hand washing survey found only 32% wash their hands after sneezing or coughing, 21% wash their hands after handling money, and only 42% wash their hands after petting a dog or a cat. A recent study of dentists in New York State found that they only practiced correct hand hygiene 75% of the time. More important to you is the fact that many of your patients either don't wash their hands or they wash them incorrectly. Teenage males are the least likely to wash their hands. This is a good illustration of areas that we tend to miss when washing our hands. I know that I tend to miss the back of my thumbs and between my fingers. It's a really good idea to post an illustration like this at all sinks that are used in your practice. How long should it take to wash your hands? Well, if you sing happy birthday to yourself or repeat the alphabet from A to Z, that's the correct time, approximately 20 to 30 seconds. Try it and you'll be surprised how much time you should spend washing your hands than what you actually do. One hygienist told me recently that she normally takes the full 20 to 30 seconds after each and every patient because it's one of the few times she has an opportunity to actually stand still for the 20 or 30 seconds. The Center for Disease Control looked at hand hygiene products and found that alcohol-based hand rubs are the best way to practice hand hygiene. If your hands are not visibly dirty, alcohol gels are the most effective hand hygiene agents. Antimicrobial soaps are better and plain soaps are good. If your hands are dirty, however, then it is necessary to use soap and water to rinse away the dirt. If you use refillable soap dispensers in your office, do not top up the soap. Empty the soap dispenser as much as possible, rinse the container and dispensing pump with hot water and let it dry overnight. Topping up containers may lead to cross-contamination. Bar soap should never be used in a healthcare setting. Dispense enough alcohol gel into your palm to wet your hands, remembering all areas, and rub for about 15 seconds. Using alcohol gels cuts the time needed for hand hygiene by about 50%. Since the gels dry quicker and faster, it also makes it easier to re-glove. Dry hands dramatically reduce irritation caused by gloves. Initial reaction to alcohol gel use is that it causes dryness. What has been found, though, is that skin irritations are reduced by using alcohol gels. Alcohol gels will never fully replace the need for hand washing, but they do save time and improve hand hygiene compliance. Long nails and artificial nails can be a hazard in a healthcare setting. Chip nail polish can promote bacterial growth and prevent adequate hand hygiene. Rings, bracelets, and watches may impede adequate hand hygiene, as well as making it difficult to don gloves and possibly cause tearing. Bracelets or watches should be covered by cuffs and long sleeves of protective equipment. Your hands are your livelihood, so it is important that you do everything within your power to keep them healthy. Find and use a good protective cream, especially important with Canadian winters. Petroleum-based lotions should be avoided during the workday, as they may weaken gloves, resulting in increased permeability. Also, washing hands with hot water is not recommended. Gloving is not a substitute for hand washing. Hand hygiene should be practiced before you leave the operatory or lab, when your hands are visibly soiled, after contact with any object that may be contaminated, before and after treating each patient, before donning and after removing gloves. Just as surfaces cannot be disinfected without cleaning first, instruments must be cleaned before they can be either disinfected or sterilized. There are many studies that prove that dirty instruments can impede the sterilization process. Ultrasonic cleaning machines have been popular for several years. All offices now use hot water detergent instrument washers with or without thermal disinfection features. Because these machines minimize contact with sharp instruments, they may also reduce the risk of sharp injuries. Your goal is to keep the instruments wet or moist, as this prevents bioburden from drying on the instruments. Remember that pan that had lasagna in it and you didn't soak it overnight? Same sort of idea. Better to let it soak and deal with it in the morning. It is suggested that hand scrubbing be kept to a minimum and be done only after the instruments have been processed through an ultrasonic or instrument washer. Hand scrubbing can then be done on a clean instrument with most of the bioburden removed. If you must hand scrub, always use a long-handled brush and proper personal protective equipment, including heavy-duty, puncture-resistant utility gloves, mask, protective eyewear, or fluid-resistant goggles. A long-handled brush allows you to keep the instrument immersed during scrubbing, keeping hands above the waterline and away from sharp instrument ends. Ultrasonic cleaning solution should be changed a minimum of daily. Depending upon the type of practice or how busy you have been in a day, it may be necessary to change the solution more often. If instruments cannot be processed immediately, an enzymatic foam spray can be used to keep them moist, or dirty instruments can be placed in a holding solution. Independent testing done showed that a properly operating ultrasonic cleaning machine was effective in removing more than 90% of the bioburden on instruments during a 10-minute operation. Even water removed 89.2% of the bioburden, proving the effectiveness of the ultrasonic cleaning machine rather than the detergent that was used. You can test your ultrasonic to ensure it is performing correctly. Hang a piece of aluminum foil to the bottom of the tank and run the machine for 30 to 60 seconds. The foil should be evenly pitted. If it's not, you should speak to your service tech. The ultrasonic cleaning solution is the dirtiest solution in your dental practice. Please take care when putting instruments in to minimize splashing. Wear protective eye so injuries don't happen. A survey was done in Washington State from 1995 to 2001 about percutaneous injuries to dental personnel. 75% of their injuries were to dental assistants, and most occurred while cleaning instruments. Using an ultrasonic cleaning machine or washer rather than hand scrubbing can dramatically reduce this figure. The major concern is minimizing exposure for you. Once the instruments have been cleaned, they should be rinsed and inspected. Some offices use an instrument dip to lubricate hinges and eliminate rust. If the instruments are not heat resistant and are classified as semi-critical, they can be immersed in a high-level sterilizing solution. In Canada, registered cold sterilants would contain glutaraldehyde, OPA, or hydrogen peroxide. Now on to the sterilization process. Whatever type of autoclave you have in your office, exposure time and temperature are critical. Always follow the manufacturer's instructions for warming up and operating the autoclave. Never interrupt a sterilization cycle by opening the chamber door. If you must retrieve an item, start the cycle over from the beginning. To keep from contaminating instrument packs, allow them to dry inside the chamber before moving and handling them. The first steam sterilizer was created in 1880, but it wasn't until the late 1940s and early 50s that biological and chemical indicators were used routinely to monitor the sterilization process. No single quality assurance monitoring method assures that any item is sterile. Rather, it assures that the conditions for sterilization to occur have been met. Remember, an instrument must be cleaned before it can be sterilized. Monitoring the sterilization process can be done mechanically. You assess the cycle time and temperature from gauges and displays during each load. Examine the temperature record chart and computer printout. Process indicators are the most basic. These are tape and the indicators found on paper or plastic peel pouches. Remember, a change in color does not mean the item or items are sterile. It just means that the temperature was reached during the cycle. Integrating indicators are designed to react to all critical parameters over a specified range of sterilization cycles. Indicators for a steam autoclave react to time, temperature, and saturated steam. Biological monitoring is your best assurance that the sterilization equipment is functioning and instrument processing procedures are being performed correctly. Test strips are saturated with heat-resistant bacterial endospores. If they are killed during the sterilization process, then less resistant microorganisms in numbers commonly found on dental instruments likely could not survive the process. Current infection control guidelines with regards to biological spore testing recommends that spore testing be done weekly. Reasons for positive results tend to be caused by human error, overloading, inadequate package separation, incorrect or excessive packaging material, improper time, improper temperature, and improper method of sterilization. If you receive a positive spore test, what do you do? In summary, this is what it comes down to. First of all, wash your hands the way your mother always told you to do. Take the time to read the label, although sometimes I know that's going to be a challenge. And clean your instruments, because if they aren't clean, they can't be sterilized. Thank you so much.
Basics of In-Office Infection Control has been presented by Linda McClarty, BA.